despite the scientific evidence on the adverse effect of the gestational diabetes mellitus on the health of the mother and child was already known. Only until 2012, it began to develop its direct and standardized management in pregnant women in Colombia's routine care. The publication of criteria and standards update worldwide in terms of detection and management of gestational diabetes standards had been ignored in the country or had a poor implementation. The turning point of this trend occurred in Barranquilla and was the conception and implementation of New Life Project, a health program for the control of gestational diabetes to 25,000 pregnant women. The program was implemented in this city for 3 years and then became a permanent institutional program on local public health network. New Life was supported by a grant from the World Diabetes Foundation, Novo Nordisk, and by the Barranquilla's Health Office. Objective: to contribute to the improvement of care of gestational diabetes in Barranquilla by the development of a clinical guide, update guidelines, training of professionals in health, adaptation of the local health system, and the implementation and monitoring of developed guide. Methodology: universal screening was applied. Awareness campaigns were used in the attempt to reach target population to be induced by the measuring fasting glucose on first visit and/or test oral glucose tolerance between 24 to 28 weeks with load of 75 grams according to the clinical detection and management guide developed for this purpose. Diagnostic criteria used were glucose fasting greater than or equal to 92 milligrams per deciliter or 5.1 millimole per liter. Post-low after time greater than or equal to 180 milligrams per deciliters, P10.0 millimole per liter. Post-load after 2 hours greater than or equal to 153 milligrams per deciliters, 8.5 millimole per liter. Blood glucose fasting greater than or equal to 126 milligrams per deciliter or 7.0 millimole per liter at any time, it was considered pre-existing diabetes. Women diagnosed with gestational diabetes were referred for treatment and cited for educational intervention in 3 group sessions. Results: New Life established in 3 years the first guidelines for the detection and management of gestational diabetes in Colombia. It was formed 72% of health workers, including obstetricians, linked to the local public health system. Additionally, 1,269 community health workers were trained. 21,169 attended the measurement by means of basal glucose in first visit or oral tolerance test glucose between 24 to 28 weeks. 1,853 pregnant women were diagnosed with gestational diabetes at a rate of 8.8%. 29% of the diagnosed women was not recorded as a risk factor. All pregnant women diagnosed were referred to treatment. 90% of women attended nutrition consult. 709 participated in 3 sessions of educational workshop groups. In general, 4 of 5 pregnant women attended public health centers, were educated in gestational diabetes and healthy lifestyles. Thanks to this program, in Barranquilla increased the number of patients with coverage of counseling by 250%.